Hello. I want to provide an industry alert on two issues. One is orthopedic urgent cares, and the other is case rate contracting by payers. Orthopedic urgent cares are now coming into our space in a very big way. In Chicago, there's 47 orthopedic urgent care clinics already. And I just heard from a group in the Southeast that the last three clinics they opened were followed by three orthopedic urgent cares, all three of which asked them for referrals. So why is this happening? I think we need to think about that. They realize that we're referring so many cases to them that all they need to do is hire their own APP, a nurse practitioner or a physician assistant, to see the patients in their office. And then some of them, well, why don't we just do an urgent care and see those patients? So the second thing is the case rate payer contracting. They want to contract with you for case rate, which is usually a lot lower than your average fee-for-service billing. And in some cases, it's getting down to where it's a triage rate. And in Florida, a major payer just recently went no rate, meaning they're not contracting with urgent care anymore. They're going to use some other means, such as probably telephonic nurse triage with multi-specialty groups with all the different specialties. So the common denominator of these two threats, in my opinion, are the fact that our medical providers in our clinics are increasingly less experienced. That is, we're hiring less experienced APPs because of market forces in place. And so we owe it to them, though, to train them. We owe it to them to support them and provide them the wherewithal that they need, the education, the seminars, the online tools, and that type of thing in order to support them practicing it at a higher level, or at a level where they're not referring so many cases of non-displaced fractures, dislocations, eye injuries. These things are being referred routinely to the point where the payers are saying, what do you do? Or, we're just going to pay you for triage. And so we will lose the injury space completely if we don't take action immediately to maintain our service level and our value proposition to payers that we can treat injuries. We can do the x-ray. We can treat the fracture with a support, a splint, a cast, a boot, all of these things. It's incredibly easy to treat a metatarsal fracture with a boot. It's as easy or easier than seeing a pharyngitis patient, and the benefits financially are greater. You have the x-ray, the DME, the E&M code, some cases the prepackaged pharmaceutical, especially with worker comp. So please get on a webinar with me for OcDoc 1. I'd love to show you the tool, because this tool can definitely address this issue and help to support your providers so they can practice at the necessary level in the urgent care center.